Hello, my name is Trisha Galligher, and I'm going to be telling you guys a little bit about the administration of blood. When a patient comes into the hospital and their hemoglobin and hematocrit are low, the doctor will usually order blood. Some other reasons why the doctor may order blood is cancers, anemias, surgeries, car accidents, or when they find out that the patient has internal bleeding. Before you can start the process of blood administration, you need to make sure that there's a doctor's order. They will also order for a type and cross match to find the patient's blood type so they can find a proper donor. After the doctor's order has been written, you need to make sure a consent form has been signed. If the patient is unable to sign for themselves, there will be a surrogate or medical power of attorney that you will need to contact to get them to sign the consent form. Before going to get the blood, you need to make sure that the patient has a patent IV. They usually like for the IV to be an 18 to 20 gauge to ensure proper blood flow. You also need to make sure that there's blood tubing and that it is primed with normal saline and that the patient has it going before you go down to get the blood. You need to take a set of vital signs and have them written down before going to get the blood to make sure the patient is stable enough to receive the blood. If the patient happens to have a fever, for example, you may need to pre-medicate them with Tylenol. When you go down to get the blood, you need to make sure that you take with you the patient's consent form, the doctor's order, and the patient's information. When you are down receiving the blood, you will check with the lab personnel the patient's name, date of birth, the identification numbers, the physician's order, the blood type, and the expiration date. Once you have checked that and you take the blood back up to the floor, you will then ask another nurse to go to the bedside, to the patient's bedside, to check the blood again. At the bedside, you must make sure that you're at the bedside when you check the blood. At the bedside, you'll need to check a few different things. You'll have the blood bag and the blood administration tag. You'll want to make sure that you check the unit number on the blood bag with the unit number on the blood administration tag. You want to make sure you check the blood band number with the blood band number on the blood administration tag. You want to make sure you check the blood type on the blood bag with the correct blood type on the blood administration tag. And finally, you want to make sure you check the expiration date with the expiration date on the blood administration tag to make sure they are all correct. Once you have checked those two, you'll then want to check the blood administration tag with the blood band and the patient's armband. You want to check the blood administration tag with the blood band number on the blood band, along with the blood type on both of those. You want to check the patient's name, the patient's birthday, and the medical record number on the blood administration tag to the patient's armband to make sure that it is the correct patient before you begin the process. After 2 licensed personnel have checked the blood, you will then begin the blood transfusion. You'll want to make sure you stay with the patient for at least the first 15 minutes to monitor them. Before the administration begins, you need to let the patient know of different transfusion reactions that can occur, such as flank pain, any chills, if they start to feel warm, or if they start to itch anywhere. After the first 15 minutes are up, you need to recheck the patient's vital signs to make sure that they are still stable. If they have developed a fever, you may need to medicate them again with Tylenol. Then you will let the blood transfuse. You want to make sure that it doesn't go in any longer than 4 hours. After the blood is finished, you will take a final set of vital signs. You will let the tubing flush through. You will make sure to record your name, the date, and the time you stopped the blood on the blood administration tag. You'll also make sure you sign your name. Helpful hints to remember with blood administration. There's approximately 320 milliliters in a bag of blood, and that is to go in no longer than 4 hours. Normal saline is the only fluid that can be ran with blood. And that's my little tidbit on blood administration. Hope you guys have a good day.